Today, we will be discussing everything you need to know about dysarthria, including types, symptoms, intervention techniques and tips, and how the individuals and caregivers are affected. It is important to understand how to identify dysarthria because it is commonly confused with apraxia.
What is dysarthria? It is weakness in the muscles that affect speech. Common causes include nervous system disorders and other conditions that affect muscle paralysis. A few causes are cerebral palsy, TBIs, strokes, and brain tumors. In the video you are about to watch, the man demonstrates incoordination and weakness causing his words to be slurred.
Do you find it difficult to use the telephone at home?
No, really, but sometimes I get say words. I didn't go right over the telephone. I'm trying to
So some words don't come over very well.
And people don't understand it.
As you could see in the video, the receptive language skills of the client were completely intact because he understood every question the SLP asked. He knew exactly what he wanted to say, he just didn't have the muscle coordination to communicate it clearly. Here's an example of a child dysarthria case.
Is it autumn today?
Do you remember what it is today? It's not autumn.
What's
it's
it?
Winter.
Winter.
Yeah.
What's up?
As you can hear in the video, there is muscle incoordination and weakness in his speech. All cognitive functions are intact, which is how you can differentiate between dysarthria and apraxia.
There are 8 different types of dysarthria, including flaccid, which is associated with disorders of the lower motor neuron system and/or muscle, spastic, which is associated with the bilateral disorders of the upper motor neuron system, ataxic, which is associated with disorders of the cerebellar control circuit, hyperkinetic and hypokinetic, which are both associated with disorders of the basal ganglia control circuit, unilateral upper motor neuron, which is associated with the unilateral disorders of the upper motor neuron system, mixed, which is a combination of any of the dysarthria types listed above, and undetermined, which is where features of dysarthria are clearly shown but do not fit into any of the categories previously listed.
The symptoms of dysarthria mostly stem from the 4 systems of speech. The respiratory system decreases respiratory support and limits to short phrases. The phonatory system creates a breathy vocal quality. The resonatory system creates hyper or hyponasality, and the articulatory system creates distorted and imprecise consonants, and this stems from weakness and incoordination of the articulators.
Intervention techniques for dysarthria should work on strengthening the oral motor muscles, increasing breath support, and slowing the rate of speech. These can be achieved by practicing one word at a time with the client, over-exaggerating speech, doing oral motor exercises that work the tongue and the lips, using a pacing board to slow speech, and pacing words better using a metronome.
An individual with dysarthria has difficulty completing everyday tasks by themselves. This can include eating and drinking, getting dressed, bathing, brushing teeth, walking, and other things. They now need a caregiver, and this can become a full-time job for the caregiver depending on the severity of the dysarthria. This is a big change for both people involved because at one time they most likely were able to do things by themselves. The individual will also most likely need speech therapy.
The number one most important tip when working with patients with dysarthria is to be patient. Provide an alternate form of communication for them, such as sign language or a picture board. Let them speak and let them take their time. Be sure that you're in a quiet, well-lit area with minimal distractions, such as the TV off, and keep the lights on. This can be a natural environment, including the patient's home or school, or in the therapy room. Another tip is don't pretend to understand them if you don't, because this can frustrate them and confuse them more. Make the topic that they're discussing clear so they know what to say. Sit across from them and face them so they can understand them best as possible. Thank you for watching.